Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Good morning, Chair Nelson and members of the board. Madam Clerk, may I have my slides? Next.
1 second. Okay, go ahead and proceed. Thank you, Dr. Reynoso.
Great, thank you. This morning's briefing, I'd like to spend some time giving your board a COVID-19 data recap and then proceed to share with you our current vaccination efforts, touching base on Delta variant and how that is impacting our community, as well as sharing with your board the latest school guidance that was issued yesterday. Next. So this data recap covers the data that we have collected and shared for the last 15 months. So from March 2020 to June 2021. This figure presents the number of COVID-19 cases by month in Santa Barbara from March 1st, 2020 through June 30th, 2021. During this time, Santa Barbara County reported 33,584 cases of COVID-19 infection among our community members. There was a summer wave of cases between May and September 2020, peaking in July with 2,985 cases. Cases rose during November, December, and January, surpassing the summer wave. January had the highest case count since the beginning of the pandemic at 10,207, more than triple the case count of the summer peak. The second wave of cases may be associated with holiday gatherings and increased travel. With the introduction of vaccines in December and the implementation of mass vaccination clinics this spring 2021, we saw sharp drops in cases since February 2021. June 2021 had the least number of cases since the beginning of the pandemic at 192 cases. Next. This graph describes COVID-19 cases in the 10 geographic regions in our county. Communities with smaller populations were aggregated in order to comply with privacy and HIPAA regulations. So overall, the yellow line, which is Santa Maria, had the highest case count at 11,665 and has been disproportionately impacted by the COVID-19 pandemic. The orange line is for the city of Santa Barbara, which had 6,519 cases. The bright pink line is for Lompoc, with a total of 3,852 cases. All areas experienced their monthly peak in January. Santa Maria consistently had the most monthly cases. Next. The Santa Barbara case rate peaked in January of 2021 at 64.6 cases per 100,000 and was then followed by a steep decline. By the end of May 2021, the lowest case rate of 0.9 cases per 100,000 was reported. The last 6 weeks has maintained a low case rate, so hovering between 1 to 2 cases per 100,000. The most recent week reported a case rate of 1.9 per 100,000, which is very similar to what we saw mid-May. Next. This graph describes the death count by month. COVID-19 deaths have been seen to increase about 3 weeks following case increases. As the number of cases declined in August, the number of deaths continued to remain high. This was also seen in January and February of 2021, following the rise in cases in the previous December and January. The number of deaths per month peaked in January with 169 COVID-related deaths, followed by February with 76. Next. Testing positivity peaked in the first week of January, with 16.8% of all tests conducting being positive in Santa Barbara County. The lowest HPI, the health equity metric quartile, saw a peak of 29.7% of tests being positive early on in the pandemic, then saw a second peak in mid-January. Fortunately, positivity rates have been declining since January of 2021 to a low of 1.0 in May. There has been a very slow increase in the month of June, but overall, the community positivity rate currently falls under 2%. And the lowest HPI quartile has been slightly over 2% in the last 2 weeks. Next. Vaccination in Santa Barbara County began when vaccines were made available to the public in December 2020. As of June 30th, 2021, we have 463,733 doses administered to Santa Barbara County residents. And as eligibility expanded with each tier, the volume administered increased each month, peaking in April with 148,684 vaccines administered to Santa Barbara County residents. And as more residents have received their first dose, the volume of second doses administered increased later in the later months. Next. So, next. This graph describes vaccine administered to residents by race, ethnicity as of June 30th, 2021. Of those residents who have been vaccinated with documented race, ethnicity, vaccine status was evaluated within each race and ethnicity. Native Hawaiian, Pacific Islander has the highest proportion of fully vaccinated individuals in Santa Barbara County at 68%, followed by whites at 47% and Asian at 45%. A greater proportion of whites, 52%, were at least partially vaccinated compared to Hispanics at 44%. Over 50% of residents who identified as American Indian, Native Alaskan, Black, Hispanic, or multiple races were not vaccinated as of June 30th, 2021. Next. So this graph describes vaccine administered to residents by age group. Reviewing all residents vaccinated by age group, older individuals are more likely to be fully vaccinated in Santa Barbara County. The 75 plus age group had the highest fully vaccinated percentage at 76%, followed by the 50 to 64-year-olds at 75%. The older age groups have been eligible to receive the vaccine far longer than other age groups. Additionally, focused vaccine clinics at retirement homes and facilities with older, more vulnerable population vaccinated older adults. The last age group to be eligible for the vaccine has the lowest number of fully vaccinated. The 12 to 15-year age group became eligible in May 2021. And of this age group, 29% are fully vaccinated. Next. In summary, from March 2020 through June 2021, 33,584 cases of COVID-19 were reported in Santa Barbara County. Santa Barbara County experienced a second wave of cases in the winter that surpassed the summer wave. The number of cases and testing positivity in January were the highest since the start of the pandemic and may be associated with the holiday gatherings and increased travel. The majority of cases were working adults, 18 to 29, and 30 to 49-year-olds. January and February 2021 saw the highest number of deaths, which typically followed case peaks by 3 weeks. Hispanics and Latinos have been disproportionately impacted by COVID-19 in Santa Barbara County. Next. The city of Santa Maria had the highest case count, followed by Santa Barbara and then Lompoc. When taking into account area populations, the unincorporated North County and Santa Maria areas continue to have the highest rates of disease. We saw 224 outbreaks in congregate settings. The agricultural and manufacturing sectors have had the most reported business outbreaks. And as of June 30th, 2021, 463,733 vaccines have been administered to eligible county residents. So this means 49% of residents are fully vaccinated and 56 have received at least one dose. Next. So the strategic actions that your public health department are taking. We are focusing outreach efforts with our partners to increase vaccination rates by zip codes. And I'll talk a little bit more later on in the presentation about that effort. We are increasing messaging regarding the importance of vaccination to younger age groups. And we have been partnering with employment sectors to slow the spread of infection among frontline, meaning agricultural laborers, unskilled restaurant, bar, and food prep workers, supporting staff who need to quarantine or isolate, reinforce social distancing and masking in these job sectors, and offering mobile vaccines at the work sites. Next. So I'd like to share with you our current vaccination rate as of July 11th. We are seeing 68% of eligible Santa Barbara County individuals with at least first or single dose. Of that, we are seeing 59.7% fully vaccinated. And switching over to the bar graphs, it describes percentage of vaccination by age. So as I mentioned earlier, the 12 to 15, we have 30% of this group being fully vaccinated. In the 16 to 29-year group, we have 53% fully vaccinated. In the 30 to 49-year-olds, we have 53% vaccinated. Among the 50 to 64-year-olds, we are seeing 75% fully vaccinated. Then in the 65 to 74-year-olds, we are seeing 71% fully vaccinated. And lastly, in the 75 plus age group, we are seeing 76% vaccination. And this data is available on our website. Next. This is data that CDPH is currently offering, and we are also providing a link on our website as well. This is the vaccination rates by zip codes as of July 6th. So this is ranked from the highest vaccine equity metric to the lowest. As a reminder, the vaccine equity metric score looks at factors that impact health, like income, education, and access to healthcare. The zip codes range from the less healthy community conditions in quartile 1 to the more healthy community conditions in quartile 4. So we will be working with our community partners, and our vaccination program, the mobile program, will be also working with the 23 community partners who are currently doing outreach and education, so that we can be laser focused and very nuanced uh, according to the zip codes, according to the community, so that we can get community members living in that zip code to increase their vaccine acceptance and readiness for vaccination.
Dr. Reynoso, I just have a quick question. I see 100% in Carpinteria. Is that accurate?
That is accurate.
Bob, that's just one of the zip codes. It's only a couple hundred people. The majority of Carpinteria is 93013, which is 68%. So the one that's 100% is a great accomplishment, but it's only a few hundred people. It's not most of Carpinteria.
Okay, thank you.
Next. With regards to our mobile vaccination program, we continue to offer mobile vaccination to neighborhoods at work sites. For the week of 7/7 to 7/11, we offered 9 clinics, 3 in markets, 4 with our community-based organization partners, 1 in a housing complex, and 1 at SBCC. So we are seeing fluctuations in the demand for vaccination, and we will continue to offer it, especially as we focus on zip codes and neighborhoods. Next. I'd like to talk a little bit about the Delta variant as of June. So in California, the Delta variant made up of nearly 43% of cases that the state analyzed. In Santa Barbara County, that number is close to 50% of specimens sequenced. And as of this morning, that percentage is increasing. So we know that the Delta variant is 2 times more infectious than the coronavirus that initiated the global pandemic. And this may explain the upward tick in new cases in Santa Barbara County. We are seeing a slight increase in cases, especially in the past few days, ranging from 36 on Saturday, 18 on Sunday, and 20 on Monday. The key message that we are pushing out is vaccination. It remains critical for protection against infection, especially with circulating variants. Per CDPH, in California, the current case rate is 4.9 per 100,000 among the unvaccinated, and significantly less among the vaccinated at 0.6 per 100,000. Next. Yesterday, CDPH issued its school guidance for K through 12 for the 2021-22 school year. The guiding principle is that all students must have access to safe and full in-person instruction, and as much instructional time as possible. So the goal is to get all students back in school and keeping them in school. The guidance contains 2 requirements: universal masking for indoors and case reporting, contact tracing, and investigation. So universal masking requirement allows for the minimum physical distancing requirement to be gone. So no more physical distancing requirement with the universal masking. Universal masking also allows for modification in the quarantine. CDPH announced this morning that they will be working on revising guidance to allow local officials, the school officials, to have discretion about how to enforce the mask mandate, just as they had been doing the previous school year. With regards to the requirement for case reporting, contact tracing, and investigation, per AB 86 and California Code Title 17, schools are required to report COVID-19 cases to the Public Health Department, and schools are to assist the local health department with the contact tracing and investigation. The guidance, the remainder of the guidance, which is available online at CDPH, the remaining guidance contains recommendations. So recommendations for how to provide ventilation for indoor spaces, on staying home when sick and testing, on screening and testing, recommendations on quarantine and isolation, as well as for cleaning surfaces, recommendations around food service and vaccine verification, as well as the COVID-19 safety planning transparency.
Dr. Del Reynoso, I have a couple questions on this slide. You said that there was something new that came out this morning, that there'll be a local effort. Can you repeat that portion of your
Yes.
presentation?
So in the original guidance that was offered yesterday, there was lack of clarity about what to do for students who will not be masked. And so the state is working on the language to clearly state that local school authority will have that discretion, just as they had in the previous school year, to make that determination.
So just to clarify, that's the school district will have that decision for their, case by case basis. Each district will have the ability to monitor and enforce that.
Chair Nelson, this was really right off,
Okay.
hot off the press via a Twitter and a paper, a
Governing by
newspaper
Twitter.
article.
Thank you.
So I don't have the details other than a tweet from CDPH that says that they will be working on the language around enforcement and local authority.
Thank you, Dr. Del Reynoso.
Great. Next. This is our last department presentation on COVID-19 around public health response efforts. I'd like to conclude by thanking your board for all your support and leadership throughout the last 16 months. As I presented earlier, COVID-19 is not completely behind us at this stage and may be a fixture for some time given the Delta variant and how viruses progress. So as we transition to routinizing our public health response efforts, this is a good pause to reflect on the community collective effort for the last 16 months. Again, I'd like to offer my gratitude to your board, and as well, I'd like to thank our CEO and her assistant CEOs as well. In particular, Terry and I have been working quite closely for the last 16 months. So I'd like to thank the CEO and the assistant CEOs for their guidance and for the resources, providing the resources whenever we needed them. And we did need resources to effectively mitigate the spread of COVID-19 in our county. I'd also like to thank the county departments for lending us so many helping hands. I don't think that we could have done this without being bolstered by all of the county departments. From the early days, we had help with contact tracing and case investigation. And then for the past 3-4 months, working in the mass vaccination clinic. So huge thanks to all of the county staff that worked alongside us in our response efforts. We are tallying about 272 county and cities redirects to assist us. In addition, I'd like to acknowledge the state redirected staff to help Santa Barbara County. We had about 150 staff from the state, and we still have state staff in our county supporting us in our vaccination clinics. I'd like to thank the community volunteers, the healthcare partners, the business partners, the community-based organizations, and community members. We could have not, again, effectively responded without all their support. I think that that as a community, we have come through fire and brimstone these past 15 months, and we emerge more resilient than ever. We have forged and strengthened our working partnerships with our community members and partners to protect the health of all residents and to mitigate the impact of COVID-19. As director, I can say that public health was never alone in this fight. So we deeply, deeply appreciate the support we've received throughout our COVID-19 response efforts from everyone. And I'm sure I missed a few sectors, but really heartfelt gratitude to, in particular, to all of the healthcare partners for their current vaccination efforts, and everyone for being our ambassadors in outreach and education around the vaccine. With that, I conclude my briefing.
Thank you, Dr. Del Reynoso. I know Supervisor Williams has a question for you.
Yeah, with the unfortunate, well, first of all, I want to protect you to protect the privacy because it is a small sample size, of course, to protect the privacy of the families of those that have passed away since vaccines started to be available. But it is, to me, enormously gut-wrenching to see death figures in April, May, and June after vaccines have been available. Can you give us any ballpark of how many of those folks were eligible to be vaccinated? You know, that just from a sense of, is this, are their deaths totally unnecessary? Could they have been prevented?
Supervisor Williams, through the chair, I'd like to ask Dr. Ansorg, since he closely reviews each death certificate, to respond to your question.
Chair Nelson and members of the board, with regard to preventable deaths, it's striking to see that in particular, our recent deaths are in 100% unvaccinated people. That is very unfortunate. It is very difficult to decipher in hindsight whether any deaths early on, like in April and March, could have been prevented by vaccination if the vaccine had been available, or if the individuals would have declined the vaccine. Now, it's also important to understand that many people who died maybe in March or April had been ill with COVID for quite a while and couldn't have received the vaccine due to the severe illness that they suffered from. I know that's maybe not completely satisfying answer, but ever since May, I would say every single death could have been prevented by a vaccine.
That is hard to hear. And I guess I would just think it my duty to keep on asking that particularly it pains me to see a lot of areas, a lot of groups of people in the county, vaccination levels lower than I would hope, and just want to urge folks that are healthy, folks that don't have contraindications, that is symptoms or potential problems from vaccine, to go get vaccinated. You know, if you're an adult that has heartburn about your kid getting vaccinated, well, then you sure better get vaccinated in order to heighten the safety of the community and your family. That being said, I do want to register some puzzlement with the idea that you can go to a concert, you can go to a large group of folks as adults, but that the most restrictive place in terms of regulation, it seems to be, is ironically among children, including elementary school children that our experience and the science indicates are harder to contract it than everyone else. And as an adult, I'd much rather take more restriction on myself so that kids had less restriction. So to me, I'm a little puzzled, frankly, by that double standard, whereas adults are free to go about without restriction, but kids who seem to take hours and hours of exposure in order to contract it if they're younger, that is 10 and under, have the most restrictive environment. And I guess a question to public health personnel, because there are some places in town that are interpreting an educational environment as a Sunday school or even a church sanctuary where children are present. Is that also required for masking essentially anywhere there are children? Because that is definitely how people are interpreting it in some sectors in the community.
Supervisor Williams through the chair. So this guidance is specifically for K through 12 school guidance. And noteworthy per CDPH, there's 66%. So 66% of 7th through 12th graders are not vaccinated. And K through 12, obviously, because they're not eligible, are not vaccinated. So that increases their risk. And universal masking is indoors. And again, just a reminder, this is indoors. The K through 12 will have a requirement for universal masking. When it's outdoors and when there's eating, it's not universal masking requirement in place. That being said, I do want to share that there have been studies or case studies in California where there is when children are exposed, there are outbreaks. For instance, in a county with very high vaccination rates among the eligible adults, in a second grade classroom with the teacher unmasked, the first 2 rows of kids in this particular classroom got infected, and then another subsequently another second grade classroom in the same school got infected. So it's while children are lower risk in getting infection, they are not immune, and so that is why CDPH has issued the universal masking requirement in order to increase the protection for the children so that every one of them can feel safe going back to school and that they can be remained in school should they be exposed. And I don't know if Dr. Ansorg can share his thoughts as well.
Yeah, thank you, Dr. Dorino. So I would just add that cumulatively, the kids are exposed for longer periods of time during their normal school day. And CDPH has basically eliminated the social distancing requirement, which is very difficult to maintain with kids indoors. So therefore, this seems like as the most efficient measure to implement so that kids stay safe. And obviously, I understand that some parents will have issues with that. However, there are also many parents who would not be willing to send their kids back to school unless there was universal masking. So we have to balance this out somehow. And those schools are usually more crowded and have less real estate and are usually in neighborhoods with more poverty and less affluence. And just as a equity measure, it's really important to balance this out. And it's a big responsibility for our children, because even though they don't get infected much, we have seen 16,000 hospital admissions in the United States and over 360 deaths in children. So it does occur, and obviously it is even more tragic if a child dies unnecessarily from a preventable infection.
Thank you, Dr. Ansorg. Supervisor Hartman.
Yes, I had a couple of questions about the Delta variant. In the materials, it's 2 times more infectious. Do we know anything about how lethal it is? And is there reason to believe that it affects the same, that it goes after older people? They're more vulnerable than younger people?
Supervisor Hartman, through the chair, there is no evidence so far that the Delta variant in itself carries a higher mortality rate. However, just because it infects more people, there are, in the end, there will be a higher mortality rate, but not for the individual patient. So it's a little bit controversial, my statement, I understand that, but it's like the variant seems to be more transmissible, but not necessarily causing more severe disease. Now, having said that, it's also important to note that the elderly folks who usually get sicker or middle-aged, they have a higher vaccination rate, and therefore the protection is better.
And last question, do we know any likely FDA approval for the vaccines?
There's no timeline to my knowledge that we have that we are getting FDA approval anytime soon.
Okay, thank you, Supervisor Hartman, and thank you, Dr. Ansorg. We're going to go ahead and go to public comment on this item, and then we'll come back. I know Supervisor Labanino has some questions, and so do I. So,
Well,
Madam Clerk.
just one
Oh, yeah.
request that they may have it available, and they may have it available while public comment is going on. I'd just like that when we do these reports, since there is attention being put on, the subject of children, and because I just want to be, internally consistent. I have joined many other Democrats in criticizing conservatives for not using the science and not taking the science seriously enough to combat this disease. But I also want us to be guided by science and numbers. So I want to make sure that we report out how much of our cases are children 10 and under. So that would be my request either now or in the future.
Thank you, Supervisor Williams. Madam Clerk?
Chair Nelson and members of the board, yes, we have 2 requests to speak on this item. We're going to begin with Andy Caldwell to be followed by Renee O'Neill.
Mr. Caldwell, when you're ready.
Chair Nelson, members of the board, Andy Caldwell representing CoLab. We're disconcerted once again that your staff will not separate the conflation of cases with illnesses. Somebody may test positive with the PCR test because it was never that accurate to begin with, and they call that a case, even though the person was not ill. Secondly, they talk about how many people got the COVID shots, but not how many people had natural immunity because they got sick with COVID and they survived. We'd like to know what numbers had natural immunity plus the potential for vaccine immunity. The other thing they are ignoring is the issue of vaccine injury. Now, I understand it's only a small percentage. I understand that. But nonetheless, upwards of 500,000 vaccine injury reports, including 9,000 deaths, 28,000 hospitalizations, 56,000 urgent care visits across the country, plus tens of thousands of allergic reactions should be disclosed. You know, you're always supposed to disclose a risk and not just the benefit. And the other thing is there's a concept. I did a show with the doctor a couple of weeks ago. This is off a Wall Street Journal article. There's an emerging concept called immunity debt, a COVID immunity debt. They describe this as that the immunity debt phenomena occurs because measures like lockdowns, hand washing, social distancing, and masks were not only effective at controlling COVID-19, but they also suppressed the spread of other illnesses. And they are now coming back with a vengeance. New Zealand, France, England, and a number of other countries are reporting that children are dying from something that they may have only gotten sick from because their immunity system got weakened as a result of the lockdown. And finally, we always talk about say his name, i.e. George Floyd. Well, I'm inviting you to say her name, Stephanie Wazil, a Royal Grande teacher, died from a heart attack from the Moderna vaccine. It was immediate. She died. Stephanie Wazil, say her name. I'm not against shots. I had the public health director's representative on the show talking about where people can get shots. I don't tell them get them or don't get them. But by golly, I want full information. I want people to be fully informed about the benefits and the risks of all of the above, including a weakened immune system because we were locked down for over a year. Thank you.
Thank you, Mr. Caldwell.
We will now go to Renee O'Neill, who is our final speaker.
Good morning, Chair Nelson, supervisors, and the committee on COVID. First, I want to thank Dr. Rianoso and Dr. Anzorg, their team, and our county staff for doing an excellent job in providing comprehensive reports in guiding us through this very strange pandemic. It is concerning to me when I hear news reports of Delta variant increasing across the country. I would like to know how many people in our county and our nation are currently being tested for COVID. And do the number of cases being reported reflect the true number of cases? On another note, last night on the national news, I heard report that Johnson & Johnson vaccine has been found to increase risks of getting Guillain-Barré. Granted, the numbers are really small. It's like 100 cases out of millions and predominantly affects men over the age of 50. But I have had Guillain-Barré and therefore can never get a flu vaccine. And this is one of the main reasons I have chosen not to get vaccinated at this point in time. I have done extensive research on the CDC site, Mayo Clinic websites, and they report that people with a history of Guillain-Barré, quote, may get the vaccine, but I cannot find any national study or surveys that address the ratio of risks. Frankly, I'm still uncomfortable getting the vaccine without first seeing evidence of extensive research studies on this. So I continue to avoid exposure as much as possible. I'm blessed I have the ability and choice to do that. I've considered the risks of not getting vaccinated and the fact that I have the option, if God forbid I did get it, of getting ivermectin as a treatment. So with that said, I'm asking, what is your opinion about people with a history of Guillain-Barré getting vaccinated? And can you point me to a study or send me a link to a website that might give some research that's been done on, and I want to see thousands of case studies, not just a few, on people who have had Guillain-Barré, gotten vaccinated, and did not have a adverse reaction. I would love to get vaccinated, but I'm not comfortable doing that at this point in time. How can you help me? Thanks for listening. If you got an answer, I'm listening.
Thanks,
That
Ms. O'Neill.
That concludes public comment.
All right, so go to Supervisor Lavanino and then back to Santa Barbara for Supervisor Williams.
Thank you, Mr. Chair. And I don't have an answer for Ms. O'Neill. Maybe if somebody in public health will reach out to her, I'm sure you have an email from her that you can respond to. I was really encouraged by going to slide 11, which is the vaccines administered residents by age group. I think it's really clear when you look at this is that when people sense that there is a strong possibility that they could be negatively impacted by COVID, they get vaccinated. At least 83% of people 50 and above. Some of these, it was 83%, 84%, and 85% by the oldest age groups of people that have at least received one shot. Now, I know that doesn't mean they're fully vaccinated, but it does say that they are not vaccine resistant. So, I'm heavily encouraged by that. And I think it just is a matter of people in that 16 to 29 and 30 to 49 age group that don't feel, they're weighing the risk and they don't feel that dread that I did in my age group of if I get it, it's not going to be good for me. I did get it. It wasn't good, but it wasn't as bad as somebody that's older than I am. So, I understand that people are just going to make choices. People still smoke. When you look at the pack that you're looking at tells you that you're probably going to get lung cancer. They'll still do it. People still drink and drive. People still will drive without a seatbelt. So, I think we've done a good job of getting to that 80% mark, mid 80s. And I really want to, since this is our last report for the time being, give a big shout out to Dr. Reynoso and Dr. Ansorg. You've had to, for the first time in our lives, navigate us through something that's never happened before. And in an ever-changing crisis environment where people were looking at you. And I know this isn't what you all signed up for when you took these jobs, that you probably didn't plan that there was going to be a pandemic. I know you studied for it, but real world is different than when you're in a textbook. The thing that I was most impressed of both of your, I guess it's almost your personality, the way you were able to, I know throughout the state of California, there were so many public health officers that ended up quitting. They weren't, They didn't have the makeup to deal with the onslaught of public backlash that comes with trying to tell people what they should do, even if it's in their best interest. So just your demeanor, your calm approach, the ability to take what the public dished out is very commendable. And you both really showed yourself in the best light possible. I traveled this weekend, so I ended up wearing a mask. You have to go back to wear a mask to go inside the airport and fly. And I've only had a mask off for 3 weeks, right? And it was like, man, this sucks. I don't want to wear a mask, you know? And it was strange. It had gotten so normal, and then it got strange to put it back on. So that's why I want to encourage people to continue to get vaccinated, is that do your research, do your homework. Like Renee said, there are going to be still some people in our community that can't get vaccinated for whatever reason, but and those that still hold out because it hasn't been FDA approved. And I'm looking forward to when that happens, because I don't want to go back to the restrictions that we had. So that's all I've got.
Thank you, Supervisor Lavanino. Supervisor Williams, and then Supervisor Hart.
Well, I want to thank Dr. Do Reynoso and Dr. Ansorg and the whole public health department for their service throughout the pandemic, and our CEO's office folks that were aiding them. And I mean, I do think this comparative risk issue is a good subject for discussion, because there are still some people who, for a variety of reasons, haven't gotten vaccinated. Though I do notice a somewhat of a correlation in income level in the county and vaccination, which usually is an ideological phenomena. But for those, you know, to me, I evaluate it like this, and I'd love Dr. Ansorg or Dr. Donoso to add some of the data. But my impression is the comparable risk is very large, is very large difference. That there's a much higher risk from COVID, even now, than there is from something, you know, from an adverse reaction to the vaccine. And that's coming from someone whose wife had a very heavy adverse reaction to the vaccine. Now, she got it done. It was very important. She's a mental health provider for the community, so it's pretty important for her to be able to be there for her patients and for the community. But I'm still very certain that we face a lot more risk from COVID and the transfer of COVID than we did from the vaccine. And to me, as a surfer, it's kind of like the question I always get, you know, when someone finds out I'm a surfer or a diver, good 60% of the time, their first question is, aren't you afraid of sharks? And I go, okay. I go, well, sure, but just look at the data, right? You're more likely to get hit by a falling piano, or you're more likely to get a bolt of lightning than you are to get you know, attacked by sharks. And furthermore, you know, if you're afraid of risk, why are you afraid of getting on the freeway, which is the most dangerous thing any of us, except maybe a few of us that are in law enforcement, do. And so I think there's something about our culture of rare events and the attention it gets of a rare event that makes people feel like it's more of a danger than it is. And so we're more afraid of dying from a shark bite on our way to the beach than we are of taking the freeway on the way to the beach, when our risk is much higher from that freeway on the way to the beach. And so, you know, what I ask the community is to weigh risk based on numbers, not based on the attention that it gets from the media or the attention that it gets on social media, but to weigh risks based on the numbers. And my understanding, the risk based on the numbers is that you're still much more at risk from the disease than you are from side effects of the vaccine.
Thank you, Supervisor Williams. Supervisor Hart.
Yeah, I think Supervisor Williams' question to Dr. Reynoso and Dr. Anzorg about that relative risk is a perfect opportunity for them to set the record straight. So Dr. Reynoso, Dr. Anzorg, could you please comment on that?
Yes, Supervisor Hart through the chair. I want to say that Supervisor Williams was so eloquent in his example. There's little more that I can add, but you know, when you look at our case rate, we're comparing case rate per 100,000. And we know that the case rate is not zero in our county. So the per chance of people getting infected is real. It is very real. Comparatively, when we look at adverse events, first and foremost, anyone can report an adverse event to the national database. Much of that is unsubstantiated, and much of that reports are still being investigated. So I would not, and then I'll say it, most of those numbers have been misused and used in misinformation campaigns to dissuade people from getting vaccinated. And when you look at that intentional misinformation, it is heartbreaking because you just have to look at the number of people who've died in our community. You look at the number of people who've been hospitalized in our community, and you look at people who have had the infection and who are now suffering through long-term effects. Those are very real in comparison to the rare side effects that could happen, and those rates are 1 in millions. So it is really not a balanced conversation. Dr. Ansarg, do you have additional thoughts?
I do. Supervisor Williams through the chair, thank you for your comments. I agree. I'm still scared of sharks myself. However, I respect the science behind it. But sharks, ever since the movie by Mr. Spielberg, create a little bit of fear. So COVID doesn't create enough fear. So I think somebody should make a movie on COVID, what it can cause in people, long-term effects and short-term effects. So the best numbers we have, because you requested some numbers, came about because of these rarely occurring heart inflammation due to the Pfizer and the Moderna vaccines in young people. And the FDA and the CDC and CDPH and everybody took that very seriously and really crunched the numbers. And they found that there were about 323 cases where they did see a direct correlation to the Moderna or Pfizer vaccine in people under 30 experiencing this significant side effect. None of these died, and everybody did recover. And to put it in perspective, after that was under 30-year-olds only, but 12.6 cases per million doses. That is like the rate where this occurred. And to put it in perspective, that the vaccine, giving the vaccine prevented 5,700 infections, 215 hospitalizations, and at least 2 deaths in boys between 12 and 17. So it is a very a stark difference if you look at hospitalizations and this heart inflammation that oftentimes did not require hospitalization, and that people actually recovered, fortunately. We don't take that lightly, but there is a higher risk of getting a heart inflammation due to COVID or due to other viruses than through the vaccine by far. And yeah, we can definitely get more numbers for other age groups, and I'm happy to provide that to you.
Well, thank you, Dr. Dorenoso and Dr. Answer. That's very compelling information, and I hope folks are listening carefully, because the relative risk question probably is what's animating some folks' reluctance to get vaccinated. And we want as many people as possible to be safe and protect themselves from what is still an active threat out in the community, because folks are getting sick, and unfortunately, some of them are having significant health consequences and even deaths as a result. So we want everybody to be vaccinated. And I just want to take this opportunity, like my colleagues, to thank Dr. Dorenoso and Dr. Anzorg and the public health staff, all the county staff that have been so deeply working hard in this COVID response. This truly has been an all hands on deck effort for 16 months, which is just extraordinary. There's been a lot of things that people have not been able to do because they've been just working so hard nonstop. And we can't thank everybody enough. And I know Dr. Dorenoso has organized an event, I think it's tomorrow, to thank the volunteers for the public health department and to recognize there's the staff that have been doing this work for so long. And I just want to add my voice to that and say thank you. What you've done to help us through this will never be forgotten, and is really an extraordinary testimony to your commitment to the county and to the residents of Santa Barbara County that we're deeply indebted to. So thank you.
Thank you, Supervisor Hart. I've got a few questions for Dr. Dorenoso and Dr. Anzorg. So if I understand correctly, now we have the local health officer orders have expired. Is that correct?
That is correct, sir.
Okay. Under what conditions would we potentially issue new health officer orders? Just so as we move forward, and hopefully this is the last time that we have a public presentation on this, since that hopefully it becomes a more of a background issue. And just for the general public, we will still have a COVID item, but on the administrative agenda moving forward. So there'll still be an opportunity for the board to ask questions, get updates, and even for the general public to comment on that. But so just so as we move forward, what would you be looking at, Dr. Anzorg, as you move forward on when and where you would potentially issue a new local health officer order related to COVID?
Sure, Chair Nelson and members of the board, we are looking at case rate per 100,000, which is currently was at 1.9. In our old tier system, that was better than the yellow tier. So we are still in a very good position. We would get a little nervous when we are reaching 4 cases. That would be doubling of what is going on right now. We would definitely take a closer look. And at 6 cases per 100,000, we would probably consider reinstating certain mandates, or at least recommendations.
Well, that's very helpful. Thank you. Because I think that it's good for the community to know what those benchmarks are. You know, there's always been a discussion about a moving target throughout this pandemic with some of these regulations. I know that as we get new information, there's been a desire to reevaluate. And I think that that's really helpful to the public to hear that from you, Dr. Anzorg. The other question is, I read through the CDPH guidelines yesterday, is it sounds like herd immunity is now called community immunity. And just want to get our terminology correct. Do we have a number there that we're looking at? Because is that a moving target? I know we still don't know as much about that, but when do we get a chance to, I guess, declare victory, or that we're out of the woods? Is it 100%? Is it 80%? You know, is it a case rate? I mean, how does that all work? I think that'd be helpful for us to understand.
in order to reach this magic level of herd immunity, which essentially means the disease is exterminated, or the battle is won against this disease, you would need at least 95% of the population to have immunity. That is a very high bar. So we are looking at having to live with COVID probably, and COVID is a moving target because it does change. So we are fortunate that all variants are, all our current vaccines are protecting us against severe illness and hospitalization, so forth, from these current variants, but that could change in the future. So it's very difficult to predict the behavior of this virus, but it will probably remain in the community on a hopefully very low level, and therefore not be completely eradicated.
Right. Thank you, Dr. Ansorgan. Turning to the CDC guidelines, the Biden CDC on K through 12 standards, it says, together local public health officials, school administrators should consider multiple factors when they make decisions about implementing layered prevention strategies against COVID-19. It seems the state has taken the approach to go for universal masking, but theoretically, would it be possible for to equal the same type of protection using other layered techniques as universal masking offers? I mean, social distancing, not every school is the same. I understand that what we're seeing out there, but would it be possible to protect your student population through other measures besides universal masking?
Well, we have very few public health measures at our disposal. One is, as you mentioned, social distancing, and contact investigation and isolation and quarantining of people who are either infected or who were in contact, as well as masking. And if I had to pick one of the three, I would pick the masks. It is by far the most effective way to prevent the spread of the virus. And since the school authorities wanted to get away from the social distancing, it comes at a price that the most effective tool at our disposal cannot be remain unutilized. If you don't social distance, you're in a crowded place, and therefore indoors. You're only talking indoors, and therefore you should wear a mask, especially for kids under 12 who cannot get a vaccine.
So, but if a school could provide social distancing, that could also offer, a layered prevention strategy that could also be helpful for schools.
Right. Chair Nelson, I think the nuance here is that because CDPH has issued their K through 12 guidance with two requirements, one universal masking, the other disease reporting, here locally, regardless of whether we have districts that can safeguard the social distance and do other things, we would still need to abide by the two required portions of the guidance as stated by CDPH. We can be more restrictive, but we cannot be less restrictive than what the two requirements state.
Now, I understand that there's the authority issue, right? There's a science and there's the authority. And because since we're under the authority of the CDPH, we need to abide by that. But I just want to, have that discussion or understand, is there another way to provide using science, other ways on disease prevention in a school environment? And I think I'm hearing yes. If there's social distancing, if there's other techniques that are involved, it is possible for a school to be able to protect their students and the community. But we have the authority of the CDPH, so we're not flexible enough locally, but scientifically, as recognized by the CDC, that is possible.
Well, I want to say one other route.
Let me have
Mr. Chair.
ask Dr.
Oh, sure.
Anzor to answer that question, and I'm glad to let you jump in, Supervisor Williams.
Yes.
Thank you, Chair Nelson through the board and members of the board. What we're dealing with right now is a virus that behaves differently. More than 50%, we can safely say that absolutely more than 50%, and the numbers are climbing up, of current infections are due to the Delta virus. And this virus spreads farther. So we are not sure whether the 6 foot is really a safe zone anymore. And we would love to have science on this, but it develops so quickly that it is impossible almost to get good data in a timely fashion to make best decisions. And therefore we have to rely on anecdotal evidence, you know, like this elementary school in the Bay Area County where the first and second rows were all infected by one teacher just taking the mask off for reading something out loud. So it is possible that the social distancing is not equivalent to mask wearing, and therefore I would not feel comfortable recommending it as a replacement. The social distancing is not a replacement for masks.
And that wasn't what I was suggesting, the social distancing alone. My point was going back to the CDC guidelines. It talks about layering,
Yes.
addition, measures. And so, obviously universal masking is one layer, but could there be other layers that are stacked that can equal that is what I was trying to get at. And so I'm not sure if that's helpful in clarifying what I was asking.
No. It was very clear what you were asking,
Okay.
sir, and maybe I didn't make myself clear enough, but we actually only have these 3 methods. That is contact investigation, masking, social distancing, and maybe hand washing. That is, those are the 4, and good ventilation. So if we take the social distancing away, there's a significant hole in the protection, and that's probably why CDPH feels very strongly about this masking.
Right. Supervisor Williams?
Well, Mr. Chair, I mean, because of the massive rise in screen time among school kids, because of the massive disenrollment from our public school system, a 20% drop, because of, in Carpinteria alone, it's a 10% drop. Unfortunately, that's better than some places. I'm very concerned about the long-term effects of measures on our particularly our smaller kids. But I also know that one other route to get there would be if every adult that doesn't have a health reason not to get vaccinated got vaccinated. I mean, we might not get to eradication, but we might get so close that some of the other measures would be unnecessary. So one of the other routes I just want to put out there, I guess we're beating a dead horse, is if almost all adults got vaccinated, many of these measures would probably be unnecessary.
Thank you, Supervisor Williams. And I guess my greater point about this is I just think it's a bad strategy, the universal masking for vaccinated students. As a parent of 3 high schoolers, the only one parent of 3 high schoolers up here, I'm hearing these conversations. This is a huge disincentive for our young people to get vaccinated, that nothing will change for them. I mean, we can bombard them with facts and data and whatnot. The single biggest thing that I'm hearing out there is if I can not have to wear a mask anymore, I'll go ahead and get vaccinated. Okay, and so we're taking that off the table. I think it's a mistake. I know that we're worried about bullying and other things. I would hope that there's a healthy school environment that people can still respect each other's choices or health conditions, and that we could eventually allow vaccinated students into the classroom in an indoor environment. I think it's a total mistake that CDPH is making. Obviously, CDC has recognized this. I wish our own state health department did, because I think the direction that the rest of the country is going is a successful one, scientifically as well as socially. You know, we are having, as Supervisor Williams pointed out, a significant amount of students that are checking out. And I think that this is another measure that doesn't make sense and is going to further dissuade people from wanting to go to school. I know it sounds like a small thing, but where the rest of their world that they no longer have to wear a mask, their whole entire family's throwing away their masks, but now they got to go grab one to show up in classroom. It just doesn't make sense. As Supervisor Williams pointed out, that you can go to a concert. And when something doesn't make sense, I think people, start to reject that. And so again, I think this is a really poor public policy call on the state. I don't think this is, I understand there's a scientific basis, but I think that there's other layered measures as recognized by Biden CDC that can also provide that protection for our student bodies and our communities. So those are my thoughts.
Yeah, I understand. Chair Nelson, maybe I may, as my last comment to this is that this is not cast in stone, or, this CDPH is absolutely reconsidering this and reevaluating this on a regular basis. And, come September, hopefully the situation will look different.
Right.
So I wouldn't take this is not the law of the land for the rest of the school year. Depending on the trends and the behavior of the Delta variants and so forth, I'm sure that CDPH will reconsider this on a regular basis.
Well, thank
Chair
you for that,
Nelson,
Dr.
I
Heinsberg. Yes.
totally hear your concerns about students going back to school masks. I have a teenager myself, and observing her with her friends, I understand about how challenging it is to wear a mask and how it can be a demotivator. But I think that the public health department, what that tells me is that from now until November, when CDPH will reevaluate this guidance, is our commitment and dedication to work with our community to make sure that the 12 to 18-year-olds, we increase the number of that population vaccinated, because right now it stands at only 1/3 of that eligible population is vaccinated. So we have a lot more work to do to achieve a point where we can be convincing that say, okay, for everybody's safety, we don't have to wear masks anymore. We need to improve our vaccination rate among the 12 to 18-year-olds.
Thank you, Dr. Dovernoso. At this time, I think there's no other questions. Oh, Supervisor Hardman.
I just wanted to add my expression of gratitude to those of my colleagues for our public health department, and especially the leadership of Dr. Ansorg and Dr. Do Reynoso. You've been measured and it's professional, and it's really inspired confidence across the county. I've often said to people, government can't do it alone. And one of the great things that you've done over this period is engage community partners in a way that I've never seen before, and across the board. And I think that again is a testament to the kind of confidence you inspire and how you are able to adapt to changing conditions. And I'm really looking forward to seeing how you use those relationships to enhance community health and well-being going forward. So thank you very much.
Thank you, Supervisor Hart. With that, can I get a motion to receive and file formula item number 1?
So moved.
Second.
Madam Clerk, will you please call the roll?
Yes, Chair Nelson and members of the board. And just for clarification purposes, that is to approve staff recommendations A through C.
Yes, ma'am.
Thank you. Supervisor Lavanino,
Aye.
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Hartman,
Aye.
and Chair Nelson.
Aye.
Motion passes unanimously.
Okay, so for the purposes of agenda management, since we're definitely behind, I'm definitely going to try to get through items D through 2 through 5, or sorry, 2 through 4 here quickly. And if we move through those quick enough, I think we can actually get 5 and take a little bit of later lunch. because I know we have people here for those items as well. So we'll try to get through D5 and then we'll break and have the public safety radio system replacement project after lunch, as well as utility scale solar and the Suarez appeal. So hang in there.